Cardiology is the field that you can actually take care of patients who are critically ill, and very quickly by your treatments you can actually make them well, relatively quick. The bottom line, when I say well, I mean functional state, so they can function normally, you have a normal healthy life, and you can really make a big changes with what we do. The procedures we do, the medical therapy we provide, we can really make a big change in their quality of life and actually their longevity of life as well.
There are a variety of patients, and some of them we can just treat them with medication and that helps them to feel better. Some of them they need emergency procedures, like if they are having a heart attack, we take them to cardiac cath lab, do angiography, find the blockages, and then if they need angioplasty, we do angioplasty to fix those blockages. And some of them they also need some other devices like pacemaker, defibrillator. So some of my colleagues, they do take care of those problems.
So I'm a cardiac electrophysiologist, which means I take care of heart rhythm problems. That can encompass a kind of a wide range of things, from people with palpitations to people with serious heart rhythm problems that could be life-threatening. A common heart rhythm problem is atrial fibrillation. That's far more common than the other rhythm problems that I ablate or electrophysiologists have been treating really for decades. But atrial fibrillation has kind of always been the holy grail of AFib ablations are treatment options. It's technically very difficult. Most rhythm problems we go after the particular source or the cause of the rhythm problem. But with AFib, we really try to eliminate part of the heart that is kind of causing it. And there's a special new treatment that I'm doing here using a cryoAblation, where the balloon is used to create a circumferential line to isolate the pulmonary veins from the rest of the left atrium, which is very helpful in preventing atrial fibrillation.
So it's a kind of interactive, so if I see a patient who have congestive heart failure, so I will initially evaluation and treatment, and once they are ready to discharge, then I'll call them and ask them to follow with these patients as outpatient. So what they do, basically they will call them, they will make sure that their medications are proper, they're on the right diet, and they're following up with their appointments regularly. If they are developing any symptoms before they see me, then they will call me and let me know that this patient is getting decompensated, or they're getting more short of breath, or they're gaining weight, or they have edema, those kind of things. Then we respond to that according to the situation. One of the main objective I have is that to improve their quality of life. They should feel better, and they should be able to do up to their potential. So that's one of the main criteria. And when you are feeling better, you are doing up to your potential, your life will also prolong. You will do better in your life too. So the main thing is that they should be able to do things which according to their potentials.